What is going on, y'all? Travis here, back with another episode of Grey's Anatomy, Season 6, Episode 13. Let's get into it, shall we?
We ask a lot of our patients. We put them to sleep, cut them open, poke around in their brains and guts with sharp instruments. We ask for their blind trust.
The blue one. When in doubt, always go with blue. It brings out your eyes.
The hospital staff, they love Richard. They're gonna be mad at me, just like you are.
That doesn't mean I don't think you'll do a great job. I think you'll be a very good chief.
Trust is hard for surgeons because we're trained that we can't trust anyone but ourselves. The only instincts you can count on are your own.
I feel like it's just a matter of time for
I heard there
these
was a
two.
coup.
Weber's out, Shepard's in.
All right, your sister's married to the guy. Expect me to believe you don't know what's going on.
Also heard Shepard plans to clean house. Maybe he'll start with you.
The guy's my roommate. You're the ones who should watch your back. Shepard hates the merger. You're from Mercy West.
Derek's not gonna fire people just because they're from Mercy West.
The only skills you can count on are your own. Until one day, you leave the classroom and step into the OR.
So, like, does Weber
This rate
still...
will be finished early, Gray.
Does he still get to
Might
be a
able to catch
doctor?
the end of Shepard's big speech.
And he's just not the chief, or
She's
what?
tachycardic.
You're surrounded by others.
I don't understand what happened. Everything appears to be in order here.
I don't see any bleeders. So why is her heart rate going through the roof? Everything is intact. Wait. Did I just feel movement?
She's awake, Dr. Bailey. The patient's awake.
What?
A team you have to rely on. Whether you trust them or not.
What the hell did you do?
Okay,
She's
I know you're
awake
scared
with
right
her
now, but it's gonna be
intestine
okay. Everything is
sausages
going to
outside
be
of her
okay.
body?
Just try to breathe.
Oh, bitch, I be suing. I be suing. Y'all giving me some money if I'm awake. Bitch, nah. I am not the one to wake up in a motherfucking surgery.
He looks like an undertaker.
I promised him we'd clap.
I want to thank you all for being here. As you may have heard, I have been appointed the new interim chief. It's my personal goal to make this transition as smooth as possible. I know we've had a rocky few months.
Here it comes.
Mistakes have been made. I intend to right those wrongs, bring this hospital back to its former glory.
Undertaker needs a speechwriter.
We are screwed.
Yes, you are, sucker.
And what I'm trying to say is I want to thank you for your support in advance. That's all. Okay, let's get back to work.
Awkward.
Avery, I need you to round out my charts and bring them to room 2214.
Karev, I hear that you're the future of peds. A little birdie named Bailey whispered it in my ear. I want you to work with me today so I can see if she's right. You don't think peds is hardcore? Because you can say that to my face, Avery.
No, ma'am.
Don't let the roller skates fool you. Peds is nothing but hardcore.
Peds. Who's a sucker now?
Lexi's looking cute.
Sloan was released from the hospital in LA. Is she coming back soon?
I like her hair. I feel like it's
This
a
is some
lot
kind of
darker
joke.
than
You're
it
gonna
was
look at
before.
me?
Right?
Torres, I have a hip decubitus ulcer I need you to check
A hip decuticus.
Really mature, Mark.
You sign these, you're agreeing to an early retirement. Your license to practice medicine will no longer be valid.
You're not going to sign that. You're going to sign this.
Which says that you are voluntarily enrolling yourself in the physician's rehabilitation and treatment program,
You sober up, you get out. You have your job waiting.
pending board approval.
I need some time to think.
What is there to think about? You aren't considering quitting, are you?
Sorry to interrupt, but Chief,
Oh, yeah.
Dr. Shepard, there's a situation that needs your attention.
Excuse me.
That has to be so hard, man. Take your ass to rehab, Richard.
She had the appropriate amount of anesthetic. There's no way we should allow her to stop over. It doesn't exist.
Stop. You check on the patient. This can happen. It's happened to me. Any luck at all, she won't remember a thing.
Which means she won't remember to sue us?
Exactly. Okay, how was that?
You're very chiefly. Lose the tie.
What? Totally. We're here to update you on the surgery.
I was able to resect the entire thing off of your abdominal wall.
Really? How about the part when I woke up on the table?
Ooh.
How well did that part go? Where I could smell my own burning flesh. How was that? When I was lying there, unable to speak, well, I could actually feel you butchering my insides. I was awake and couldn't move, and you had no idea. How well did that part go?
Here's what we do. I want to check the
girl.
assets themselves.
Oh, here's what we do. That girl is traumatized, so the only thing we are doing is getting sued.
You have no idea what went wrong in that OR.
I know that you're new here. I know that you probably still have a chip on your shoulder because your parking space in Mercy West was better. You make buckets of money, logging reasonable hours, sitting on your behind, while somebody on the other side of the curtain does the real work. I
You
don't
have
know
no
what they did
idea.
in Mercy West, but here at Seattle Grace, we expect to be able to trust the gas man. We expect the gas man to stay awake. We expect the gas man to stay focused enough to keep the patient unconscious.
How long would you say Brad's been having the pain?
Bailey is not the one you want to piss off.
Is the pain constant, or is it worse at times, better at others?
I have learned
It's usually bad in the mornings.
over time.
Right after breakfast. But I feel it at other times too.
Right, like when you have a Spanish test.
Stress can exacerbate abdominal pain.
Please, doctor, don't encourage him. He's just faking so he can miss school.
I am not.
Dr. Krev, how would you proceed?
We could try triple contrast CT.
This is going to cost us thousands of dollars. Only
And what
covers
if he
part of
actually
it.
has
You
something
know
wrong
that,
with him
right?
and he
I'm
dies,
not
you
faking
fucker?
it. I swear.
I noticed you have Avery assigned to all your surgeries this morning.
I do.
So there's no room for me on your service?
You've been on every one of my cases since I've arrived. It's only fair I give other residents a chance.
Makes sense.
Do you think you'll have room on your service tomorrow or the next day?
I don't know. I can't today, Christina, okay? I can't.
Leslie, this will only take a moment. We just need to examine you and check your incision.
Hey,
I don't want you to touch me.
Leslie.
Don't let her touch me.
I know that you've been through a lot today, but if we don't check...
I remember you screaming. You were panicking.
She's getting tachycardic.
With their hand inside my body.
Dr. Bailey, her incision site is waiting.
Don't touch me! Gray, redress the wound, okay? See that tape there? You're gonna need your nice long piece, huh?
That makes me feel
Need some
bad,
help?
man.
Oh, no, I'm good, thanks.
But
Okay, never mind.
I
put
need to talk
yourself
to you
in the
about Mark.
patient's shoes, you know?
He isn't speaking to me. He
That
barely
is-
even looks at me. We still work together, and I'm gonna be a plastic surgeon.
You're not gonna be a plastic surgeon.
We're gonna have to see each other every day. I mean, he's best friends with my sister's posted husband. I don't know what to do. At least he could be civil. I had a one-night stand, okay? Big deal.
Right.
It's not like he didn't sleep with Addison.
True. More than once.
What?
Nothing. I didn't say anything.
More than once?
What about that? That spot, see it?
That was lint.
Doesn't make sense. I mean, no kid wants to be the loser missing class to go to the hospital.
I loved the hospital when I was a kid. No school.
She's
Lots of cool
so
medical supplies to
cute.
play with. Okay, yeah. So let's go over it again.
He presented with severe but intermittent abdominal pain.
Labs were normal. No fever.
Soft abdomen on an exam.
We're missing something.
Chronic mesenteric ischemia.
I mean, it's a stretch for a kid, but if he had vascular problems.
No, it
What?
fits all the symptoms.
Problem is, the only way to get an accurate diagnosis is to run exploratory laparoscopy. Brad's father didn't want us to run a CT. You really think he's going to agree to exploratory surgery?
You know, Teddy's blackballing me. She's not saying that's what she's doing, but I think that's what she's doing.
So aggressive.
I don't want to talk about Teddy.
I heard he had some kind of mental breakdown.
Go practice medicine now. This sitting here, this isn't good. This isn't helping things. Just sign the paper, go to rehab.
Look, you are not my boss, and you're not my chief. You may have stolen my office out from under me.
You're in
but
trouble,
you
and
have
I'm
no
trying to
right-
help you. You're not ending your career to get back at me. I did what I had to do.
Look me in the eye, and you say that again.
I wanted the job. I wanted the job, I admit that. I didn't want to end your career.
You did what you had to do. But this part is up to me. So get out.
No!
Stop it, both of you.
Y'all need to mind your own businesses, fuckers. Don't you have shit to do?
Get back to work.
Right. All of y'all. That's why I couldn't be chief. Also because I don't know how to do those chief things. I'll be cursing people out. Mind your own business. You too. Take your ass on rounds.
Would like an apology. Leslie Wilson's cytochrome P450 results. She metabolizes anesthetic drugs too fast. There's no way we could have known that before surgery.
So this is why she woke up.
It is. You don't have to get down on your knees and apologize, but I would like something heartfelt. You were right. I was rash. Kind of mean. Turns out you're a hell of a doctor. It wasn't our fault. That's good news.
She's gonna need a second surgery.
Okay, it's not gonna be easy, but now I know how to keep her under.
She won't let me touch her.
Oh.
I'm good with patients. They always trust me. I don't even know how to... She won't let me touch her.
Why are you walking like that?
I got a burn.
Where?
Go away.
I'll let you treat my tick. Come on.
This is not a tick.
Today sucks. Mark sucks.
Yeah, you ain't got burns on her girl parts.
Don't you two have patience? How did you get burns on your ass?
There. The rest of you, bye.
Oh my God.
Not so loud.
How did you have grate marks burned into your ass?
Yeah, vent marks, but same difference. I was busy having sex. Owen's being very caveman-like. It's hot. Vaguely disturbing, but mostly hot.
Disturbing.
He might still be a little upset that I offered him to Teddy.
Ellie! Alex!
Oh.
Hot cross buns.
Bailey's paging me. Lexi, will you finish this for me? Let's go.
Sex injury?
Oh my God.
It is. I used to have sex injuries with Mark. Mark was really awesome at leaving you with good sex injuries.
Oh my God.
Please don't cry on my ass.
Hey, are you
busy? Pulled everything you asked for. It's all here in numerical order.
Numerical order? Yang always orders them according to priority. Most urgent to least urgent, but it's fine. It'll work. Follow me.
No, you are not cutting open our son. That is thousands of dollars we're talking about on what, a hunch? I hated school too, Brad, okay? Your mother and I, we have jobs. You have school. That's your job. No surgery. It's insane. Just no.
Shut up.
You think it's right for them to take him home?
It isn't.
Brad, I'm teaching. What are you gonna do?
I'd like to push his dad's face into a wall.
Yeah, no, that'd be good.
Well, barring physical violence, what are you gonna do? Your patients can't
familiar.
advocate for themselves. So, a big part of the job is advocating for them.
Yes, this is exploratory surgery. If he has mesenteric ischemia and you take him home, the blood flow to his intestine will slowly stop, forcing his body into such intense shock that by the time you realize what's happening, the chance of Brad getting back to the hospital alive is next to zero. So the only real question is, how sure are you? How sure?
Look at that proud mama.
I understand your hesitation, but
think that
we don't
kid's
have a choice. You
from-
need a second surgery. The longer we wait, she's at greater risk for infection or blood loss.
It needs to be
Cody
fixed properly.
something maybe
It
is
was
his
like being
name?
in a coffin, alive in a coffin. I couldn't talk, couldn't move. The thought of your hand back inside me,
Leslie, sweetie, you don't have to do anything you don't want to do.
you can do it.
What?
You were there. You stayed calm. You were kind.
Dr. Bailey is far more experienced
She's
than...
not touching me. You can do it. She can't.
I hate this for Bailey.
Quite a scene in the conference room earlier. What happened there? How'd you dethrone the chief?
Can't talk about it. It's not my story to tell. Looks like I'm facing a lawsuit. Patient wakes up on the table.
You know, Lexi slept with Alex Karev while I was dealing with my sick daughter.
You were doing a little more in Los Angeles than just dealing with little Slim.
She dumped me.
This is why you went back to sleeping with my ex-wife?
You slept with his wife?
I'm just saying the Karev thing is forgivable. Consider it.
Not to me. Is that a hickey?
Christina and I have been getting along.
Well, you two are good together. Way better than Yang and Burke.
Yeah, I never understood those two.
You know, I made a bet she'd never make it down that aisle. Won $50. Oh, you haven't heard that story? That's a good story.
That's not your story to tell.
Oh, shit.
Bailey's letting me operate on a post-op internal bleeding patient by myself. Do you think I can handle it? I think I can. Derek tells me you're thinking about quitting. I think if my mother were here to see this, she would kick your ass.
That's what's gonna mean something.
These loops of bowel look clean too.
Bullied them into totally unnecessary surgery for their kid.
By not finding anything, we're one step closer to finding out what isn't wrong with Brad. More suction, please.
BP took a dip.
He's getting unstable. Bolus him with the leader and let's get him closed. All right. We may not have found the problem. There's absolutely something wrong here.
What
There
is
isn't
wrong with
anything
them?
that says you can't operate once she's under. She would never know.
She wants a resident doing her surgery. She gets a resident doing her surgery. I wouldn't let you operate unless I thought you could handle it.
Well, I could perforate her bowel.
You won't. Dr. Weber was mentoring you.
Well, the chief wasn't exactly mentoring me because of my talent.
The last time he mentored a surgeon, it was me. Well, you think I don't have talent? All right, well, hurry up and finish scrubbing in. We got a patient waiting.
Did you figure out what's wrong?
Not exactly.
Why does he have a tube in his chest?
Brad became briefly unstable in surgery, so we had to put in a central line. Wait, what?
Blood. There is a lot of blood in the chest, too.
Get a chest tray and some gloves. Sir, you need to leave right now.
Like hell we're leaving.
Page Cardio and Robbins.
Oh my God. Right away,
We
doctor.
can't wait for cardio. Crap. Scalpel.
Oh my God. Oh my God.
Get away from our son!
Please,
Get away from...
Holy fuck!
More suction, please.
Let me in. What happened?
We put out more than 2 liters of blood in the last 5 minutes.
All right, jump on. We're moving to the OR. Page Christina Yang.
Right away, doctor.
Oh, Christina Yang busy. She busy.
Oh, it's Teddy. I have to.
Go. There's another resident today. Stay here with me.
No. Gotta go. Yang, you said you would always choose surgery. You fibbed. Fibber.
All right. What's going on? How is he?
He's critical. He has a ruptured aortic arch dissection.
I hardly ever catch them, but Karev here may have worked a little miracle.
Damn it. What the hell is Yang? I need a second set of hands.
You want me to scrub in?
Dr. Robin, I'm available.
She's waiting for Yang.
Believe me, I know I'm not Christina Yang. I have very good hands. I can do this. Okay, I can help.
Cannulate the femoral artery and vein. We have 30 minutes to complete this repair or this patient is toast.
Bowel looks
Oh
fine.
my God.
Okay, just check the anastomosis and keep going.
BP stable, BIS levels 45, just like the last time you asked, 2 minutes ago.
Anastomosis looks clean, bowels intact.
He's flirting. I think he has a
read
crush.
Architectural Digest, Neil. Magazine I read earlier? That was the Journal of Clinical Anesthesia.
Ready for the mesh suture, please?
I actually don't like the sitting down part of my job. It's not great for the back. I like to keep in shape so I can lift my big buckets of money.
Oh.
I yell when I'm scared. Some people whimper or duck, I yell. When she woke up, it was one of the scariest moments of my life, so I yelled. And then I yelled some more. So what I do?
Was that an apology?
Closest thing you're gonna get.
Hey! Ooh, nice skin graft. So I was talking to Lexi.
Why?
No, she came to me.
You're my friend, not hers. Don't take her side.
She made some good points.
She dumped me and jumped into bed with Karev. She doesn't get to make good points.
Mark.
She dumped me. Not the other way around. She dumped me, and for wanting to step up and be responsible with my own daughter. And you know how much I wanted to take that step with Lexi. I'm not the one who's immature. And you made me wreck my skin graft.
Leslie's out of surgery.
How'd the repair go?
No, just fine. No complications. Meredith did an excellent job.
Good. Good news. How's the lawyer?
Lawyer's still here, drooling. Tough first day, Chief. 9 times out of 10, you can make a lawsuit go away if you apologize.
True that.
And that's what Chief Weber would do. He'd walk right into that woman's room the minute she got out of recovery, and he'd apologize.
Dr. Altman, when I paid you, I expect an answer.
It was just
I had a ruptured aortic arch dissection. I thought at the very least, I could rely on you to act professionally.
Everything okay?
You're right. It won't happen again. I should have responded to your page.
No, this wasn't Christina's fault. I detained her for a trauma thing.
Now you have something to say to me. You know what? Forget it.
What are you trying to do to me?
Christina,
His heart ruptured?
This is unbelievable.
Well, his heart symptoms presented as abdominal pain. It's almost impossible to diagnose. But the most important thing is that Brad is doing fine.
You call that fine?
Dude, seriously, we're the only reason your kid's alive. You'd have been home when Brad's aorta ruptured and he'd be dead right now, huh?
Rev, we're done here. Excuse me. Follow me right now.
Well, that guy's an asshole. I don't like him.
Go away, please, Bill.
Fuck. I like
I
Karev
want you to
because he
see me
just
like
fucking
this.
shoots it straight, bro.
Everybody's been seeing you like this all day. I don't know what's going on with you, but you can't sit here anymore. Not like this.
I can't give them this. Shepard, Jennings, if I do what they want me to do, it's like saying that they were right. Right about me.
Saying they were right about what?
They want me to say I'm an alcoholic.
You are.
Well, are you an alcoholic?
Yes. But if I sign these papers, I have to stop
Alicia
drinking.
Keys.
Go to rehab. I don't think I'm ready to do that.
You are better than this. Look, the way to win, the way to beat them, you go get better. You be the chief. Be the chief.
If
Go
you
to
want to
rehab,
work in
Richard.
peds, you can't get emotional. There's a difference between advocating for tiny humans and berating terrified parents. Until you've stayed up nights with a screaming infant, raised a lying teenager, you don't get to judge parents.
That guy was an
Advocate
asshole.
For the kids. You don't get to berate terrified parents. Then you go apologize to that family.
Oh, no. Apologize to that
Karev.
motherfucker.
You saved that kid's life today. How'd it feel?
Feels great.
Oh.
Hardcore, right? Welcome to Pete.
Okay. Okay, Karev.
I know it's been a long day and you're all anxious to get home, but I feel like we got off on the wrong foot.
Y'all playing this whole song, you gonna fuck with my
I don't
copyrights on
expect to win your
YouTube.
trust overnight, but I want each of you to know you have mine, which is why I felt it was important to personally come in here and apologize. Mrs. Wilson, do you have a moment? I want to clear some things up. I'd like to offer each of you your jobs back.
Oh.
Now, there are going to be cuts down the line, but you both deserve a fighting chance.
Dr. Shepard, thank you.
Oh.
I am neither pro nor anti-merger.
Nice.
Everyone has a clean slate.
Pepner, is that her name? Oh, just make out with each other. You're both hot. Get back together.
I am not focused on the past.
I'm trying to understand you.
You've been trying to screw me into submission. And I let you because the sex was so good and your ego was hurt.
I am trying to know you. I am trying to love you, and I don't know how.
Oh, so the vent burn was you branding me? Like I'm chattel?
I'm trying! I don't know you. I don't know you because you don't give me anything.
I give you everything.
Burke. Preston Burke, you were engaged. It was almost a wedding. Why didn't that happen?
No, we're not doing this.
See, you give me nothing. Maybe I was trying to screw you into submission. Maybe I was trying to connect.
Well, Burke is irrelevant.
Oh, yeah, like I'll be in 3 years' time.
Jade.
That's not fair. I'm trying to love you. Why won't you let me?
Burke? Burke was, he took something from me. He took little pieces of me. Little pieces over time. So small I didn't notice, you know? And I made myself into what he wanted. One day I was me, Christina Yang, and then suddenly I was lying for him and jeopardizing my career until I was standing there in a wedding dress with no eyebrows. I wasn't Christina Yang anymore. And even then I would have married him. I lost myself for a long time. And now that I'm finally me again, I can't. I love you more than I love Burke. I love you. That scares the crap out of me because when you asked me to ignore Teddy's page, you took a piece of me. I let you.
She is so so good.
And that will never happen again.
I'm looking to the future.
Damn.
You feel better?
A little.
This really isn't gonna work for me.
To all the promise this hospital has to offer. I plan to honor Richard Weber and his legacy, not undo it. Thank you, Richard.
Good. 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 Good.
Sorry.
Good.
Which is why I'm both humbled and honored to be your new chief of surgery.
Damn. That was such a good episode. They always are, though, aren't they? Imagine waking up on the table, and I know that has happened to people before, obviously, and it's not something that you would want to have. But I don't know, because I've never even been put under. I'm terrified of it in general. Waking up in certain, that's a huge fear that people have. That I could not imagine. And thank God that Karev had that hunch about the kid, poor Bailey, and I'm glad Richard's gonna go get help. And I don't know about Owen, Yang, and Hunt. They're kind of stressing me out a little bit. I just don't know if it's right. I feel like he's a little too aggressive. I feel like, I don't know. I'm not feeling the vibes. I'm not feeling the vibes. Or I'm starting to get bad vibes. I don't know. Usually my vibes are kind of right. So I feel like I'm nervous about it. And Derek being the new chief, I'm here for it. I think it makes sense. I just can't wait to see what happens next. I love this show. Let me know what y'all thought about this one. I'll see you on the next one. Bye.